Wonderful. Thank you so much for having me. And I apologize that I could not make it in person to your fantastic conference. It's really a shame, but due to several reasons, it was not possible this time. So thank you so much for giving me the chance to present here today. And as you have heard already, I will give you some insights into the topic of social media use and well-being, touching very different things today. And I hope it will be worthwhile. And as mentioned already, hopefully there is not too much overlap with things you have heard already. Well, the things I present today belong to a bigger research area where we speak of digital well-being, which is a rather blurry term, I have to say. There has been put forward one definition by Mrs. van den Abele, where she says digital well-being is a new concept that refers to the lack of balance that we may experience in relation to mobile connectivity, and clearly, this field is vast, and much of the findings we have observed in this field are clearly influenced by the way we design studies and by the way we pose our questions. And so, therefore, it might be not surprising for you to hear that we also speak in this field of the so-called the jingle jangle fallacy. Namely, if you take a look at the studies in the field touching about well-being and digital use, in particular also social media, you will see that some researchers ask about relations between social media use and life satisfactions. Others ask about emotional well-being, which is related but not the same. Others speak of the absence of well-being and go into the direction of psychopathology, such as depression, anxiety, body dissatisfaction, cyberbullying. Addiction is a common research theme, or reduced cognitive functions. And this all shows you that we have really to speak very clearly about what we are studying to understand also the findings from studies and to understand what actually has been done. A next area which we really need to make progress is to also define about what kind of digital use we speak of. So, what kind of digital medium we use, and is the focus of research, is it the time on a certain device? Is it the time on a certain application on the device, which could be a social media platform? And here also, what kind of platform? Is it active or passive use we are speaking on of a certain application? Do we use a framework to speak of addictive behaviors or compulsive behaviors? There you see already that again, also not regarding the well-being terms, also, but also regarding the digital use, we really have to be very clear and precise about how we operationalized digital use in a way to understand what kind of effects use of different kind of media and applications have on the human brain, and of course also on the psychological process arising from our brain. So we did a couple of years a study where we asked a very simple question, namely, is overuse of certain platforms, you can see it here, Facebook, WhatsApp, or in general, the term smartphone overuse, is this linked to life satisfaction? And here we used an addiction framework where we asked people about loss of control regarding the platforms or preoccupation or withdrawal symptoms and so forth. And what you can observe in our study is that we find negative associations. So the more excessive the use, the lower the life satisfaction. This said, for everyone who's deep into statistics, you will see that the effect sizes are really, really small. And a lot of people question that these effects are of relevance at all if we speak about the digital well-being complex. Our findings are not a surprise here because if you take a look at the literature with meta-analyses, you see also that in general the time spent on devices, so we're not talking about addictive use of platforms, but here just how long people spend on social media, that this is again inversely associated with well-being. But as you can see, the effect sizes are even a bit smaller here than when we compare it to the smartphone overuse association with life satisfaction, but it's very much in line with what you observe here in our study with WhatsApp and Facebook overuse. So, in a nutshell, there are some associations in going into the inverse direction, so that overuse of social media might reduce well-being, but effect sizes are very small. And of course, as you can see here, also our study is hampered by the fact that it's a cross-sectional studies, not allowing us to imply here causality. So, if we in general study overuse of technologies and well-being, we came also up with more robust effect sizes in the past. And this had be probably also something to do with the time point where we did our studies. Namely, we carried out a large-scale study while the COVID pandemic was going on, and we asked people while the COVID pandemic was going on how their online use changed. And less surprisingly, you can see that both the male and female participants stated that the internet use got tremendously larger. Of course, that was a consequence of physical distancing. And at this time point in this study, we asked people not about social media overuse or certain channels, but overall about their well-being in the context of excessive internet use. And here you can see that the effect sizes are dramatically larger. You can see here that overuse of internet technologies or internet use is robustly associated with lower well-being. And as you can see, we have here a moderate effect size. And we were able to model this in this cross-sectional study with a mediation model, showing that those people who report to have significantly or strongly increased their internet use, that they also reported lower well-being, and this was mediated here by overuse of the internet in general. But I promised to speak about social media today, so let's dive in a bit more into the social media approach. And with a new study we conducted, we wanted to make the point that it's actually really important to define, as I outlined a bit earlier, exactly about what kind of platform use we are talking. Because all these platforms you see here, starting with Instagram, going via iMessage, Telegram, WhatsApp, Threema, and so forth to other platforms, they are defined or designed in very different ways. And the idea behind it is that different design of platforms can result also in different addictive tendencies towards the platforms, because the different social media design can have a different pull on the users. And we have two messages in this study. So one is the more social media applications people were reported to use, the higher were their internet use disorder tendencies. That makes a lot of sense, I guess. So the more platforms you use on your phone, the more likely it is that people talk about something like internet use disorder tendencies, or formerly known as internet addiction. And a second thing we observed is that it seems to be the case that occasional use of certain platforms goes along with more internet use disorder tendencies. In particular, pronounced were, for example, the effects for some of the platforms, such as, for example, Instagram or TikTok, where we observed that these platforms might be drivers of overuse of internet use disorders. So that's something to take into account, that different platforms might exert a different pull on the users. Aside from that, and that was the title I proposed for today, we know in the field that, of course, and you have seen it with the meta-analysis, if you ask very broadly this question, oh, is social media use in general related to well-being? You have seen that the associations are very weak at best. But the truth is also that we see in our data sets that some people profit from their social media use, others talk about detrimental aspects, and others say, well, to be honest, my use has nothing to do with my well-being at all. So what we need, and that is what we propose here in a paper on TikTok, but I think this can be also transferred to other areas of social media use, is that we have to ask three questions. I mean, the one question to understand the social media well-being complex is that we take into account, who are these people? Are they young? Are they older? Or what gender do they have? What personality structure? We know that younger users are more vulnerable to overuse of social media platforms. We know that certain personality traits are associated with overuse of platforms. We have to take into account the why question. So, what is the motive to use these platforms? Is it just for hedonic reasons, to have fun? Is it for social exchange? Is it a utilitarian approach, which we know also from using gratification theory? So, you use social media as a tool. This clearly is also of relevance to understand the well-being complex. And how is it used? So the how question has been decided, for example, by active versus passive use. Of course, we know that a lot of people sometimes use it active or passive. So a lot of studies, people were just asked, are you more the active or passive user? And here we have seen some evidence, but it's more complex than that, that passive use might result in social upwards comparison tendencies. So you're just browsing the feed, you're just seeing the beautiful lives of other people, you're comparing yourself and you're thinking, well, my life is not that great as shown by other people on the platforms, and that might cause envious behavior, or that you are getting through the social comparison into negative emotions, which might be detrimental. For others, it is using social media to establish social capital, to reach out to other people, to have meaningful conversations, and that would be clearly something which is more on the positive side. And just by answering all these questions and model them in a concert, we're getting closer to understanding the social media well-being complex. Um, what you see here is a study we published this year where we focused on TikTok overuse, and we applied here the World Health Organization framework for gaming disorder to better understand TikTok overuse. Um, as you might know, the World Health Organization put forward a framework to diagnose gaming disorder, which is a officially recognized disorder. This is at the moment not the case for overuse of social media. And we applied this framework just and did not use the term gaming, but used the word TikTok use here in our studies. And what we observed is two things, namely, first of all, and that is in line with much research in addictive behaviors, that in particular higher neuroticism and lower conscientiousness goes along with higher overuse of TikTok use disorder tendencies. In other words, people who have more negative emotions, people who have problems in self-regulation tend to report more overuse of these platforms. Again, no causality is possible because it's a cross-sectional study, but we know that personality is fairly stable, and therefore it might be here a disposing factor for overusing these platforms, either perhaps due to coping mechanisms. So you feel bad at the moment, and then you use these platforms just to forget about your dark thoughts and your negative emotions. And of course, those who have, in general, more problems with regulating themselves, that they are more easily lured in by the platforms. And what we observed also in our studies is that depressive tendencies are a mediator here between high neuroticism and TikTok use disorder tendencies. So that is a new approach where we try to apply the gaming disorder framework, which is officially recognized by the WHO, and to see if this is also a good way to understand the overuse tendencies of people regarding social media platforms. There has been also a controversial debate going on at the moment about how technology use is linked to creativity. This is a study done by my PhD student, Marco Müller, where he carried out a literature review first, trying to understand how is the link between creativity and technology use. And again, here we have to see, if you look up the paper, that we see that it's very complex because, again, it matters what platforms are used, how they are used, who are using them. But one thing is for sure, I mean, there is the idea in the field that technology use, if you're constantly lured in, you don't have time anymore to do some mind wandering, to think about things. And that has been shown to be also a prerequisite for creativity. And the idea is if you're constantly on your phone, you don't have these these minutes again, still where you think about things, which might reduce your creativity. We observed that there are some studies and also some data sets where we provide where are these inverse links that creativity might suffer due to technology overuse. But again, the field is very complex, and you will see that also effect sizes are really, really small. So I think to carve out these associations, to better understand them, we have to ask the questions in a more complex fashion. So who's really to blame? I mean, I told you already, technology use can be good, it can be bad. For some people, it doesn't do a lot. But what is clear is that we have an industry which is operating with a data business model, and they try everything they can to lure you in on the platforms while you're not there. And when you're on the platform, they try to prolong your online time. And this in itself poses the question, without asking, how is this related to your well-being, that this time for sure is gone for other things. And of course, the industry, by using this data business model, also takes, at least they don't care too much, obviously, about the fact that some people develop addictive behaviors with, of course, detrimental consequences for them. And if we ask the question, who's really to blame, you might say some people have certain personality traits. Well, they should change their behavior. I think we have to point to someone else, namely to those people who created these platforms, made them very immersive, made them prolonging their online time or your online time. And we'll talk about this in a second, a bit longer. There has been a term put forward, which I think is really helpful to characterize the discussions in the field. Namely, it's the term surveillance capitalism, which has been put forward by Shoshana Zuboff. And she also makes the case in her book that the industry works with a spy mentality, because you're allowing the industry basically, when onboarding on the platform, by ticking, yes, I'm okay with your policies and so forth, that they can spy on you regarding everything you're doing on these platforms. And this is, of course, used as their data business case to show you commercials with personalized ads to convince you to buy stuff. They want your attention, as you all know, and they have done this in by A/B testing. So the platforms you see today are not the platforms which have been there forever. The industry is testing and testing and testing what design elements work pretty well to prolong on the online time. And for example, if you take a look here at the graph, it is easy to foresee that if you have an endless scrolling feature, so uh, no classical end anymore, there is always new content, and this is combined with personalization, so that an AI algorithm is showing you every day the stuff you're really interested in, that this combination alone likely will prolong online time. So, and these design elements are tested, and of course, different design elements occur on different platforms and might elicit the different pull to the platforms, resulting different addictive tendencies. The problem in digital well-being research is that in the aftermath of the Cambridge Analytica data scandal, the platforms largely closed their application programming interfaces, resulting in the so-called API collapse. So the problem is that we, at the moment, have real problems in conducting our studies on the platforms. Therefore, a critical layer is missing in our data. We, of course, need to ask people about their well-being, about their use, but of course, want to combine it with objective use patterns and what they are doing online. And that is at the moment very difficult to do. We need to find workarounds. So in my group, we created applications to track phone behavior. We try to operate with data donations and so forth. But at the moment, it is very difficult to do these studies. And what's also mostly lacking, despite that we have a very discussion using a lot of medical terms, such as addictive behaviors, addiction. We talk about brain development of young users, which might be hampered by social media use. We talk about dopamine triggers, which the industry uses to lure in people users. Despite this very medical and neuroscientific tainted language, we have only very, very few brain imaging studies. And that is really surprising because the claims which are made are tremendously large. I'm not saying that some of the claims that they aren't true, but I'm saying we need more evidence and we really need more neuroscientific studies to back up these claims and to show what social media is actually doing to their users, and particularly also for young users. And I opt for a multi-methodological approach, and this is what we are doing in my work group. We are combining basically, if we can do it, mobile sensing, studying of digital footprints, self-report data, MRI data, and for example, also more molecular data such as epigenetics to understand these phenomena. So let's talk a bit also about interventions. Interventions are important to understand digital well-being. Here is a new study which we conducted where we asked the study participants to get rid of their social media apps on their phone. The instruction was not to, in general, not use social media anymore. We just wanted to reduce the constant availability by not having it on the phone anymore. And what you can see in our data is immediately already after 2 weeks, the female study participants reported that their body dissatisfaction was going down. And perhaps this was happening because they were not comparing themselves anymore with the unrealistic photoshopped world on social media. And after 2 weeks, they were allowed to install the apps again on the phone, which we did not monitor anymore. But we see even in the follow-up, 2 weeks later, that the effects even got stronger, so that the body dissatisfaction further went down. So there you see that some interventions can be used also to improve certain things. I think on a societal level, we need discussions about digital well-being, and also we need to discuss if the industry shouldn't change the data business model. Of course, this would mean that social media would dramatically change in terms of how it is designed. And of course, we would need to pay for social media, for example, with public broadcasting fees or subscription fees. And unfortunately, we see in our data that about 50% of the study participants here nearly 3,000 study participants we investigated were not willing to pay for social media. But they said at least, well, if it helps to reduce misinformation campaigns, then people were actually, you see that the willingness to pay went up, was much higher. So we have to talk to people about what the advantages are with different platform designs and business models, and to finance social media also in different ways. And this leads then to the area that we should restart social media. So we have to think about how to redesign these platforms. We have to think about how they are alternatively financed. And if you're interested in this area, you might find some inspiration in our article, Restart Social Media, but how, where we talk about how this could happen in the future to improve the digital well-being of people and to have more healthy platforms. You also know that at the moment there is a tremendous discussion going on about young users on the platforms and what the right age to onboard on these social media platforms is. The moment you know that most of the platforms are allowed 13 years or older, this age barrier came, according to my knowledge, goes back to the Children's Online Privacy Protection Act from the 90s, where social media was not available. And even this was not done with good psychodevelopmental studies. So we really need more empirical findings guiding here policy making. Although at the moment, due to all the things related to social media and use, cyberbullying, eating disorders, body dissatisfaction, and so forth, which are discussed, and also that the time is not available perhaps for more meaningful psychodevelopmental tasks, I opt in for stronger age restrictions, and that these are actually also checked on these platforms. You probably have heard that in Australia, social media platforms should be banned before 16 years, which is world news at the moment. We have at the moment the DSA, the Digital Services Act, in the EU, and this also needs to be taken into account to improve things. So I want to come to the end because we want to have more studies. Perhaps one more thought. Um, in an AI society, we will clearly not only discuss digital well-being, but AI well-being. This is something which is coming up now. And I'm happy if you support my research. We have 2 studies going on which are related also to social media use, namely how the perception of art is changing in the digital world. And you're probably familiar with the phenomenon of Taylor Swift, she relies strongly on social media, and we try to understand Swiftonomics a bit better with our study. Thanks to my colleagues, and thanks for your attention. I'm happy to answer some questions.
Now, in science, we measure everything and we have these indications and so on, but how do you measure, where would you define that it becomes an addiction? How do you define this? Like, what is the measurements? Like, okay, I don't want to give like, now you're prescripted, you're a addictive person, but how do you define this? What are the measurements?
Yes.
What would you use, or do you have any research
Yeah.
on that?
No, what we use is the World Health Organization framework for gaming disorder, and it's not the time you spend on social media. That's not a good indicator. We ask about loss of control. You want to reduce, but you cannot do it yourself alone anymore. Then it's your social media use is completely prioritized in everyday life. So everything else, what was important, is not happening anymore. Your life is circling around social media. And then we talk about that you keep on with your excessive behavior already, although you have problems. Just imagine you are using social media until late at night. You are missing, due to losing sleep and sleeping over, important a date in the morning. And what are you changing? Nothing. You keep on with your behavior. And the most important thing, to not over pathologize everyday life behavior, we need to observe functional impairments. In other words, the behavior is so grave that, for example, your romantic relationship suffers or breaks up. Or so you see, we don't talk about these things lightheartedly.
Okay, thank you. Christian, we kindly appreciate for you taking the time, giving us the insights, and of course, good luck with the Swift fans and all the other research that you're starting to do and continues to do. Thank you for your time, and on the behalf of the here the top science center of EstWell, we thank you for participating.
Thank you so much for inviting me. All the best. Have a great conference.